The numbers are still horrendous, but the death rate is slowing in Italy. The lockdown here is working. Rome, still silent. North Italy was hit the hardest by the contagion. What happened there shocked the whole country into a realization that the virus was coming and that they had to be ready for it. Nobody knew if the country's poorest regions in the south could cope. So it's a beautiful morning in Rome, but we're off to Naples, and it's two things. We're into another intensive care unit, and we want to see the effects this outbreak is having on medical staff, because many of them are getting very, very ill while they're treating people. And also there's worries that Naples could sort of lose control of the lockdown. People are much poorer in the south of Italy than they are in the north, and are less inclined to stay indoors because they need to earn money and they need to get food. And there's a great concern here that it could sort of get out of control. That's what we're going to look at. The sheer emptiness of huge motorways is difficult to get used to, but it is quite something. Through spring mist we headed south, heading towards Naples. We glimpsed Vesuvius in the distance, a volcano that centuries ago brought its own destruction, every bit as deadly as COVID-19. The citizens of Pompeii didn't heed the warnings back then. Have the people of Naples today? Is it possible that some hope for everyone in every country could lie here in one hospital, where we're told not a single member of staff has been infected, and they still haven't? This is their story. Right, so we're in Naples now. And they're waiting for us. We have to wait to see what it's like here, but it's maybe very different to the north, so we'll find out. Hi. Here we go.
This is all clean area, so we can have a clean way, and all the patients are in the room inside without contamination between the two areas.
This is a whole different level to anything we've seen before. They're wearing super advanced masks, much nearer to a gas mask than we normally see our hospital staff wearing. Their thick waterproof suits means the doctors and nurses are effectively sealed in. This Naples Infectious Diseases Hospital now only treats COVID-19 patients. Their record of 0 staff infections is incredible. It can be done. You just have to have the right gear and follow the right protocols. There is a rush on here. The patient inside is deteriorating fast. A nurse prepares an injection outside the treatment room. He never goes inside, communicating through windows to colleagues with the patient. And they never come outside during crisis moments, and this is one. When it's ready, the medicine is passed through a compartment door. Remember, he's not been inside and hasn't touched anyone or anything. But he immediately removes his gloves and scrubs down. This is an absolute constant. The lag between the epidemic sweeping through northern Italy and overwhelming the healthcare system before progressing to the south gave this hospital precious time to prepare. Cutugno is the exception in the south. It was already the most advanced hospital. Its testing facilities are world class. But even here, they're taking no risks. They may be working away from the patients, but they are in full protective gear. The vials are full of COVID-19 virus, Put bluntly, it's distilled nastiness. Mistakes here could be deadly. In this lab, they're trying to figure out just how immune you are once you've had COVID-19.
So what we don't know is if you can be infected and then get it a second time and a third time.
Yeah, actually we don't know yet. Dice, non sappiamo quindi se una volta che l'hai preso lo puoi riprendere di nuovo.
In this moment is
This moment is not possible, it's not clear yet.
Right.
Ok.
That would be a big
in breve
concern.
tempo sicuramente non prende la malattia, glielo vuoi dire.
After a short term, surely you don't take again the coronavirus.
Okay.
We don't know on the long time.
In long term.
What is really striking here is the rules of separating infected environments and clean areas are followed by everyone. But armed security man every connecting corridor in case anyone forgets. We're moved back and the corridors locked down as a new patient is brought in. This happens every time. Preparation is the key to stopping the virus. Preparation and equipment.
Is that speed with which things were organised significant as a factor in controlling the disease?
Yes.
If the hospital's organised, the treatment's better, is that right?
This is the first thing to do in this kind of hospital. It's Dr. Fiorentino now is organizing these two wards, and it's very, very important to separate the street and so on, to organize how dress and undress, how put a doctor or nurse in the room, how put your mask. It's very important.
And also you have to have the right equipment to do it.
Yeah, we fight for, but however now we are.
This is a sub-intensive care unit. The patients are either recovering or haven't deteriorated yet. But the same separation rules apply. The red and white line cannot be crossed. Clean area nurses and doctors assist infected area staff across the line. They keep the two absolutely separate.
Because in other hospitals they were together, it was too chaotic.
No,
You have to be
there
separate.
is a higher number of infection in the doctors, in the nurse.
Yeah, very high.
Yes. In this hospital, nothing.
Yeah, that's incredible.
So always two men, two doctors.
It's not incredible, they are very good.
They are? Okay.
It's very good though.
Yeah. And no others they can go to clean area.
Sure.
Okay.
Yeah.
There are two doctors and two nurses.
Right.
Okay. This is the limit.
The limit.
One question though. At the moment, you seem to have control of the numbers. This seems to be, the figures aren't getting any better, but they're not getting much worse. What happens to the hospital if there is a sudden surge? To get a point where you can't deal with it anymore?
Yeah.
We are ready to two beds in a room and in this hospital. After we have upstairs there is another
area that is going to be open.
So you can cope.
Yes. We start with this. After one day the other.
We open on the other
3
side,
days
upstairs,
Right.
and then
now
there is
it's
another
3 days,
area
another area.
upstairs here.
Okay, so it is growing. Each day
Yes,
you're having
yes.
to open up another ward and another ward.
And
Wow.
Across the world, as the pandemic spreads, we're seeing the number of infected and dying jump every day. Health workers are right on the front line and they're succumbing to the illness every day. Perhaps, though, it doesn't have to be inevitable. It isn't here. The precautions are meticulously observed. Normally, we do this removal of potentially infected clothes, it's called doffing, as a team. We do it in an area we choose. At Cotugno, they do it for you. The point is, They aren't just doing it for me, they're doing it for themselves and everyone outside. Nobody should get infected, they believe. But of course, they have the kit. They don't just hope. What happened in Italy was a wake-up call to the world. It scared us all, but perhaps now it can bring us hope as well. They don't sing as much as they used to in Rome anymore. But as the dark days brighten, they are sending that message of hope. But the sky is always bluer, they're singing. And one day it will be, everywhere.